Hello, and thank you for joining us today on another very exciting show. Today, we're going to be discussing thyroid symptoms, tests, and complications. I'm Janet Lewis.
And I'm Dr. Lewis wondering, when Janet says it's exciting, is excitement and enjoyment always the same thing?
When it comes to you and your information, yes, it is. He has got a wealth of information to share with us about what's going on with the thyroid. And we've picked this show today because we seem to be having a rash of people suddenly coming in, bringing in their lab tests to us. And their doctors are trying to either give them thyroid medicine, take thyroid medicine away. And we're looking at the lab and going, what is going on? So we're going to educate you a little bit about how to read your own lab test, which can get scary, or we're going to empower you to have knowledge so that you can at least think. And
we were not interfering with these doctors. We're giving the people information enough so they can talk intelligently to their doctor and ask proper questions.
That's correct. But, unfortunately, there are many doctors out there that go by TSH on a lab panel, and that's it. And whether it's high or low, and if it's in a huge range like it is, as on the lab, anywhere in there, they tell you it's okay. But, this particular lady we had today, we've been helping her with her thyroid now for probably 4 or 5 years. And proud to say we have gotten her back on a great track. She's been doing some other things that we've actually stopped her bone loss in its tracks with some products we give her. So, she has a lot of trust in our opinion, and we've got proof in the pudding. So when she came in with the lab today that we'd run, and her other doctor said, hey, we want to do something with your thyroid, I about lost it. But Dr. Lewis handled it much better, and so we're going to explain to you what you need to look for so that you can be a little more educated about your own health.
Well, I think one of the biggest problems in America is that we've started a reductionist theory of how we treat people. You are a thyroid, and let's treat your thyroid, rather than looking at the whole picture. And the whole picture on this lady, or at least a bigger part of the picture, was that she'd had some knee surgery, which she very much needed, very good orthopedic surgeon. And because of the anesthesia and the pain medications this lady had to take,
and Advil and Tylenol on a regular basis because she was in pain,
her liver enzymes went sky high, and so did her TSH, which normally the doctors are worried because her TSH is too low. I said, no, it's not about your TSH. It's about what your T3 is doing. Anyway, her T3 went down. So the lady said, well, my new endocrinologist wants to take away my T3. I said, well, I'm not going to interfere with what this doctor's doing, but you need more T3 and they're taking it away. I don't understand that. I said, the problem is that your liver's busy trying to detox all of this, and it can't make the conversions of the proper thyroid hormones. Thyroid's a pretty interesting thing anyway, and many, many times it's appropriate to take your thyroid medications from your doctor. We don't interfere with that, but you need to understand one thing. If you're taking necessary thyroid drugs, did you know it can lower your iron and your calcium? And many times, if you're on it long term, it can decrease your body's ability to handle iron. It can cause anemia and weakness, and it can cause your nails to get brittle. It can cause you to be irritable. But men, if it's your woman that you're noticing that's irritable, don't say anything because your life's on the line. Fatigue, osteoporosis, and that's the thing this lady was working on. And her doctor that's dealing with her bone health is absolutely thrilled with what we've done. Says, well, at your age, you're holding your own, and actually some of the markers on the bone density test are getting better. It can increase, these medications can increase tooth decay, cause high blood pressure, heart disease, insomnia, acid reflux, digestive problems, and high risk of cancer. One of the things I want to caution people is when I talk about these symptoms that go along with the possibility or probability of hypothyroidism, these symptoms can go with all sorts of other conditions also. So don't necessarily think that it's just your thyroid, and don't diagnose yourself. Not always a good thing. So, I'll just jump off into the thyroid and we'll see where we land. It's a very important gland, kind of a butterfly shaped at your throat. And it influences every cell or almost every cell in your body itself. And that's the one where it gets hypo, which is most of us. It has a tendency to make you gain weight and can't lose it anymore. You may be a little bit cold because it's, has to do with your basal temperature. It pretty much affects every physiological process in your body. Depends on the research that you read, and you can get research that says anything, so be careful with that. Some people say 10% of everybody in America has a subclinical hypothyroid, or it's less than optimal. Other research says 40%, and I've read other books that says 80 to 90%. Well, if it's that rampant, the big question is why? And I personally think it's two things. It's not enough nutrients and too many toxins. One of the things that I have to tell people, they say, okay, well, I feel better taking your stuff. When can I get off of them? And I said, you can get off of them just as soon as you want to go back to where you were when you felt terrible. But I feel good now. And, I'm a little bit of a smart aleck trying to get people to where they think differently. And I say, well, if feeling good's all there is to it, drink a beer. You'll feel better. And people think, well, that's kind of a weird way to say that. And I said, well, I'm just trying to get you to think more appropriately. And feeling good is a very good thing. The real question, the best thing you can answer is, why do you want to feel better? People say, but I want more energy. And I'll say, but why do you want more energy? And they'll say, so I can get more done. I said, why? The big question is why, if you hadn't figured that out. And if it boils down to it, it's usually because you want to be a better husband, a better wife, you want to be better parent or grandparent, you want to be a better worker, you want to be able to better provide for your family. But most importantly, I think it's because we want more joy and more peace and more fun. My middle name, I think, is fun, all capitalized. Janet says sometimes I'm too young for her, which I don't believe, but I definitely helped her jump outside the circle a few times. But the thyroid is very important that you make sure it's optimal, because it has a lot to do with these people that are depressed and have fatigue and have autoimmune diseases, have infertility. I just heard this week that we've got a young couple that could not get pregnant. Now they've been doing our program, and all of a sudden putting nutrients into the body, they're pregnant all of a sudden and couldn't for several years before. That's kind of funny.
Yeah. Speaking of that, we had and this don't have anything to do with the thyroid, but you're talking about having babies when people can't. That's one of the joys we get from doing this and helping people with their health. We had a little girl when when we first started doing the natural medicine, probably, about 10, 12 years ago, because she's 20 now, I guess. She was due for a kidney transplant. And thanks to the nutrition, we saved her from going in for dialysis. So she never went to dialysis. She just went straight in and got the new kidney. She did exactly what we told her to do with her diet and her nutrition. And I found out the other day that she now has a job working with Apple, and she is a translator speaking Dutch for the maps for Apple. So I thought that is just really cool, and that you've made a difference in somebody's life that would have definitely turned out different had she gone through the hard road of things. So it was pretty exciting to know that you've helped someone get back on the path of what God intended for them to be.
And that's the reason we do it. The why behind it is because it makes us feel good. That sweet little girl, she was real young. And in the family, they have a certain type of genetic disorder that causes the kidneys to go down. Her sister had already gotten her mother's extra kidney. And we kept her out of dialysis. I think it was for like 22 months. And Children's Hospital in Dallas, which is an absolutely incredibly brilliant, talented group of people, said, we have never seen anybody that didn't have to have dialysis with this kind of kidney disease. but it wasn't the supplements. Well, anyway, she got her brother's kidney, although I offered her one of mine. She comes back and says, Dr. Lewis, that is very sweet that you would give me your kidney, but the doctor says you are too old, with that Dutch accent. I said, well, it's seasoned. She didn't understand because she was a young girl. But, it brought us great pleasure. And when people come in, we were just at lunch, and I had a guy walk up to the table. I'm like, okay. He says, you're Dr. Lewis, and my wife is so much better. She told me when she came back that you like dark chocolate and Shiner Bock beer. I said, yep, bring it on. He said, I'm coming in to see you because you've done such a good job on my wife. And I said, it's not me. You put nutrients in, your body's going to work better. So, folks, even if it's the toxins that's causing your thyroid not to work good, you have to increase the nutrients so your body can increase the detoxification pathways, which there's quite a few of those. These hormones that are, they come from the thyroid. They interact with your other hormones, which includes insulin. How many of you have too much insulin? How many of you are insulin resistant, which is the very large majority of America because of how we eat? It interacts with cortisol. How many stressed out or have gone on into adrenal exhaustion? That's when your DHEA and your cortisol has gone down, down, down. And adrenal exhaustion takes a long time to get well. Many people think that they should get results much, much too quickly. And I read a lot of research and blessed that I can remember a lot of it. I was just reading some about cortisol and DHEA, and it said after a 6-month trial, it came up this and this and this and this, and it helped with lupus, and it helped with IBS, and it helped with Crohn's. But folks, that's 6 months, so don't expect it in 3 weeks. The thing about it is, and that's what I told this lady a while ago, so your liver enzymes went to heck in a bucket because the anesthesia and the Tylenol and Advil and all that stuff you had to take. Your liver has to convert T4 to T3, and her T3 went down dramatically. And it was her liver. I said, your liver's busy. It's not going to work taking away more T3, but you do what you want. She said, well, I don't want to hurt this doctor's feelings. And I said, and you shouldn't. She's a very brilliant endocrinologist. I think that's a good thing. I think you deserve to give her a chance, give her your opinion, or listen to her opinion, but you need to ask her questions about, well, if this drops so dramatically, don't you think it's in the liver because my enzymes went from a 20 up to a 64? It's conversion, and that's why it has hurt us in America to have a reductionist theory of you are just a thyroid or a malfunctioning thyroid, or you are just this or you are just that. Folks, do not ever own the diagnosis. Because when people say, but in 1986, I was diagnosed, those people never get well because that is how they identify themselves. Your T3, when it's inadequate, just because it doesn't produce good or it doesn't convert from T4, your entire system goes to heck in a bucket. That's a technical term, East Texas. And you need that in your DNA to rev up your metabolism to burn fat. Although we've got a lot of other things that'll burn fat, but you've got to start with the thyroid. When T3 gets correct, most people's cholesterol levels get good anyway. So quit worrying about your cholesterol and try to figure out what's causing it in the first place. Regrows hair and keeps you lean. Janet says I'm too skinny. It's like, well, it's 171 pounds, but that's not too skinny, I don't think. But the main thing you've got to understand, your thyroid's not working because your levels are usually disrupted by, number one, nutritional imbalances, toxins, and there's a lot of toxins in you get toxins from sleeping in your bed at night, allergens, infections, and stress. I'm just coming off of bronchitis, which is pretty unusual for me, but we've had a lot of deaths in the family, a lot of stresses, and it finally got to me, and have not had time to rest. Folks, rest is actually important, and I have trouble sitting still. So Even the Bible says, be still and know that I am God. And I failed at that. Folks, you need to go get quiet and sit still. So these levels, when they're disrupted by all these things, can cause all kinds of things in your system. And then there's this controversy about iodine. Every book says different things, and that's why I wrote my real short book that says this is a thyroid, this is what it does, these are the toxins, these are the nutritional supplements that you need to put in there. And then you need to find whether it's Western medicine or functional medicine or both to get your thyroid at an optimal level. Yes, I think iodine deficiency is a big deal. I think it's a major player in lack of proper thyroid function. And again, you can read 10% or 60% have the subclinical hypothyroidism I talked about. If your doctor just goes on TSH, thyroid stimulating hormone, and that's all they go by, I'm trying to be polite, they don't know what they're talking about. They're not looking at you as a whole person or holistically. And again, here's the symptoms of hypothyroidism, but you have to understand they do overlap with other disorders. So don't think it's always the thyroid, but suspect that's a possibility. Lethargy or fatigue, that's half of America because we hear that on our health survey. I think feeling like you don't have the energy to exercise, I don't feel that way. I'm just not going to exercise because I don't like to. I will stay very active. Heavy head or tired head, I heard that a million times back when I was practicing a lot of chiropractic. The people that says I could sit here and fall asleep immediately. Well, the first thing you should suspect is they have a thyroid that's not working right. Or people say, but I'm doing everything the same, but I'm gaining weight. Rough, dry, scaly skin. You know, if you got skin like a lizard, probably your thyroid. Hair loss, especially in women. And I've seen a lot of women that their hair loss could be minimized or reversed to some degree if they'll stick with it. And it can also be digestive issues. But again, you know, your thyroid going wild is usually because your digestion's not right. And we'll get into that, I hope. We have time. It's usually a gluten sensitivity. Then there's this crazy picture on Facebook that says, well, we ate bread for 5,000 years, and now all of a sudden in the last 10 years you have a gluten sensitivity. Well, it's because we have 4 to 40 times more gluten than we did just a few decades ago because the way they hybridize the wheat and spray glyphosate on it or Roundup, which disrupts the bacteria in your GI tract, which very much impairs your ability to detox. So, you know, think about that. You know, people that have goiter, I've told a story about my daughter that came in and says, Daddy, I have thyroid cancer. I said, no, you don't. We did some lab and gave her some iodine and she cleared up real good. People that even have diabetes, metabolic syndrome, type 2 diabetes, multiple sclerosis, prematurely gray hair, the autoimmune diseases, like rheumatoid lupus, Sjogren's, we see that actually quite a bit. The elevated cholesterol I did talk about, and a lot of the GI issues like ulcerative colitis, IBS, and Crohn's has a lot to do with that too.
I thought it was interesting that there were some unrelated symptoms of hypothyroidism. You know, when your thyroid is not getting enough thyroid. Like fallen arches actually can be a symptom of a thyroid problem.
And I didn't know that either. And they say left-handedness. Well, I've been left-handed all my life, so.
Oh, that's interesting. Asthma
Well,
actually could be a sign of thyroid. Psoriasis, neck pain and stiffness, carpal tunnel syndrome, hoarseness.
Whoops. Do I have my hoarse, sexy Sam Elliott voice on today?
Here's a temporary thing. Pale skin. I thought that was from not going outside enough, but maybe. And vertigo can actually be a sign of a thyroid problem.
Yeah, that's why I asked Janet yesterday, can I take some iodine home? Because I gave it to my daughter. People that scar too much, the cicatrix, I think that's Spanish for keloid. That was in a movie. I think it was a John Wayne movie. Cicatrix, the Indian chief with a big scar. Think of iodine deficiency. But now here's the controversy. Many people have Hashimoto's, and some books, these so-called experts, say never give any iodine to a Hashimoto's patient. And then you've got other books say give them 50, 75, 100 milligrams a day of iodine, even with Hashimoto's. So what do you believe? And that's why in my book, I cut to the chase. I'm not going to write a 200 or 300 page book. I'm going to say, well, get somebody that can assess you as an entire whole being, as one that understands, oh, well, your thyroid went to heck in the bucket because your liver's overloading it. It's busy getting rid of Tylenol, so it can't convert T4 to T3. How many people would go to that conclusion? So think about little things like that.
Well, and, you always speak about doing iodine and selenium. One of our personal favorites that we use that kind of contains everything as a catch-all thyroid product is something called Thyroid. It's by Orthomolecular. It is on our websites and our show notes also. But it's just got a whole bunch of good things like zinc and selenium and E and A and C and
N-acetylcysteine.
Yes.
Yeah.
And tyrosine that gets way overlooked for thyroid, actually.
Tyrosine will kind of make you feel better mentally, but it's very important in the conversion of these things. But N-acetylcysteine, what does it do? Helps your liver create glutathione, turns on those detoxification pathways, thins mucus. I've got bronchitis, so Janet's been giving me a lot of N-acetylcysteine or NAC. And that way I don't have to cough and hack all night, and I can go back to bed, not, sleep on the couch. So this particular product will kick butt and take names. And I'm putting a lot of people on it. If you got a swollen prostate, get on this. Because if you got a swollen prostate, you need the zinc and selenium, probably need the iodine. It's not just for your thyroid, but it has become one of our absolute favorites. And guess what? We've been going through a transition the last 2 or 3 or 4 months. We're already showing on lab that some of these new, more absorbable supplements are actually working. We're getting some results that even the medical doctors are telling people, I can't recommend what you're doing, but please don't stop. They're telling the patients that, and we get a lot of referrals kind of through the back door from the medical profession.
Yeah, we've been very excited with our new products. I know the Orthomolecular is a huge one that we carry because of their quality. They're a gold star company, and because of that, you can take less of the product and have an even better outcome than what we experienced in the past, where it actually costs less. So we had this one guy that has been taking a few of the products for about 2.5 months now, and he's been doing it religiously. So we've been waiting to see what happens on this lab. And he did a product called Bergamo that we're very excited about. It helps cholesterol, people that are on cholesterol-lowering drugs and have an issue with it, which a lot of people do. It bothers their liver. Bergamo does not. Bergamo actually helps go in and clean up the liver. And this guy, his cholesterol would not even register the bad cholesterol. It was so high, the lab couldn't register it.
Because his triglycerides were too high, they couldn't calculate.
Mm-hmm. And because he got on this Bergamo, his lab readings for cholesterol came back where we could actually see them, and they were hugely improved. His sugar, his 3-month blood sugar had gone down to an acceptable level.
So we all went out and celebrated with a cold beer and a piece of cheesecake.
Yeah, that's the problem. And people tell me that all the time. They're like, well, I achieved it, so I quit doing what you said because I made it. And then they start feeling bad again. I think it's like getting a test grade or something. It's like you finally got a really good test grade, so you think, oh, I'm at the pinnacle. I'm good now. And then I start eating really bad again. So hopefully he didn't do that, which I know he didn't. But we're very excited that these new products are doing so good on lab.
One of the things you need to think about also is, there's a lot of so-called healthy protein drinks, and it really bothers me that they get a lot of amateurs hyped up with pseudoscience smoke, mirrors, and bull, and get people to sell things they don't know anything about. And some of them have soy protein in them and sucralose. And I told one preacher the other day, I said, don't you think that sucralose might be a part of your dizziness? He said, I don't do much sucralose. I said, okay, just checking. He texted me a little bit later and said, okay, I threw it away. Most of these so-called health things that they're getting amateurs to promote, you need to flush them down the toilet before you filter them through your body. Most of them are crap. I'm sorry, did I say that?
You said crud.
Oh, crud. Sorry. People say, what do you think about this? I said, I think if it was good, I'd have it in my store. Well, da-da-da-da-da. And I've had several people, and again, I try to be polite most of the time while I get you to think differently. One lady says, well, what about this one product? And had that on a big podcast we did the other day. And he said, well, what about this one company? I said, it's an okay company. And he says, why don't you take it? And I said, because we had the biggest distributor of that particular company in Longview, Texas, and she was kind of a big dog making a living at it. She said, this is the end all and be all. I said, great, let's do your lab. Man, it rocked her into a whole new world of, holy cow, this stuff is not worth much. And then I had another lady that says, you should quit reading this research and you should read my research. And it was about another product that supposedly increased glutathione and liver and energy. I said, great, let's do your lab. Oh my God, she got spanked. And I don't mean in an exciting way. Both of these ladies were my age, and both of their companies, although could have been somewhat good, don't think they're complete just because somebody gets you hyped up on smoke, mirrors, and baloney. Most things are tough to achieve because of our toxic environment. I mean, if you just got bromine out of the environment, that would make your hormones better, including your thyroid hormones. But it takes a lot of work to do that, folks, and it takes a lot of understanding to do that. So
it takes a doctor that knows something about nutrition.
Nutrition. I hear that
Doctor.
Yeah, I hear that all the time.
Yeah, but I do want to mention the lab test for people that aren't familiar with what we do, because a lot of you are new to listening to our show because of the new name. Y'all are just now finding us, so welcome to listening to our show. We do lab inexpensively so that you're not guessing at what's going on. So as you're hearing Dr. Lewis speak about thyroid and the different parts of it and what you need, you're thinking, oh my gosh, this is going to cost a fortune to go to my doctor and ask for that. Well, that's why we offer low-cost lab work, and we do it across the United States. And it's done in all but a couple of states throughout the U.S. We use Quest Labs, and there's usually one very close to you. And you can actually purchase the lab on our website at greenwisdomhealth.com. And the one I would tell you, if you want to just know what's going on with your thyroid, there's always, you should really look at cholesterol and like a basic metabolic panel in the CBC. We have that panel. It's called a basic health check with a consult. All of the panels that start with GWH on our website include Dr. Lewis's consultation plus a functional medicine report and a copy of your lab. And we do that panel for $138. So there's no need at guessing about what's going on and wondering, hey, I wonder if mine's high or low. Dr. Lewis will actually read it and tell you. So we've put that also in the show notes. It is available on the website. Just go on there and take a look under lab panels and you'll see that. So there's no reason to not know what's going on with your free T3. And if you're on medication, let's see if it's doing what it's supposed to do. So go ahead, Dr. Lewis. Sorry, I just wanted to inform people how they could get their lab checked and give them an opportunity to get well.
Well, I still think it goes back to why? What should you do? Is it because you want to be a better person, a better spouse, a better parent, grandparent? I think you have to think about these things. And, whatever your motivation is, it breaks my heart to see so many people die and never sang their song. They live in a state of quiet desperation, and then they die. And it's like, God, what a wonderful, wonderful person that never got to live. Folks, have the courage to step outside of normal, which is not happy, and do something different. Break that chain and become happy again because you're healthy again. Folks, you can achieve it, and it's attainable and it's affordable.
That's awesome. So we're going to keep educating you. You know, something else strikes us that we hear a patient talk about, we'll probably come on with another show about it. If you have some ideas of what you'd like to hear us talk about, please email us. We love to hear your feedback. And thank you for all the kind reviews. And if you're enjoying our show on iTunes, especially iTunes, would you please give us a great review on there? If you don't enjoy our show, just skip over the review part. But we appreciate you listening to us, and we'll be back next week with a very exciting show. Have a blessed day.